Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Today's program is part of our Cancer Center series, a special collaboration between the Blum Center and Mass General Cancer Center. Before we get started, I just want to go over 2 items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so they can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only the Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next, I would like to introduce you all to our guest speaker. Joining us today, we have Dr. Giselle Perez. Dr. Perez is the director of the Mind-Body Program for Cancer Survivors at Mass General Cancer Center. She is also the director of the Adolescent and Young Adult Research for Mass General Cancer Center Survivorship Program, associate director of the Adolescent and Young Adult Program at Mass General Cancer Center, as well as an assistant professor at Harvard Medical School. In recognition of Breast Cancer Awareness Month, she joins us today to give a talk on mind-body strategies to enhance coping and resilience after cancer. So please join me in welcoming Dr. Perez.
Thanks so much, Amy. It's great to be here with everyone. I'm going to go ahead and share my screen, and I'll confirm with you also, Amy, that things are showing up okay. All right. Thumbs up, all set? Perfect. All right. So today's conversation is all going to be about stress and resilience. All right. And with resilience, we have to have a conversation about mind-body strategies. And I thought it would be appropriate to begin with a video to highlight just what I often hear when I talk about what mind-body medicine is.
It reminds me of high school.
You worked in a restaurant?
No, I was in India. It was humid and smelled funny.
All right, I think I'm getting into a groove here. This isn't so bad.
Only 5 hours and 40 minutes to go.
We've only been doing this 20 minutes.
You know, I read that washing dishes can be an excellent form of meditation. The key is that while washing the dishes, one should only be washing the dishes.
Just because you have that accent doesn't mean what you say isn't stupid.
No, seriously, it's about being present in the moment, focusing on the feeling of the warm water, the smell of the detergent, the sound of the dishes squeaking, and following your own breath. It's about simply being.
Huh. Okay, I'll try it.
I need 3 people out front.
Me. No fair, I was meditating.
So just like this video, for many years, people would respond with equal parts curiosity and disbelief when someone would bring up this idea of mind-body medicine, even as a complement to modern medicine. Now, while this idea of mind-body medicine has grown in popularity over the past several years, there remains some conflict between interest and uncertainty. Much of this stems from having a general lack of clarity about what mind-body medicine is and how it works. And there's also a lot of frustration that people tend to experience when they try what they consider to be a popular mind-body medicine technique, like meditation. And then they don't do it well, or they think they don't do it well. So they essentially feel like, okay, mind-body medicine doesn't measure up to be all the excitement that people report. And again, this often comes from this sort of perception that they're not doing mind-body medicine, quote unquote, well or correctly. Then there's this term resilience that keeps getting thrown around. Resilience, as defined, is the ability to bounce back or sort of continue to manage life stressors in the midst of challenging life situations. However, I've come to find that people do struggle with this concept quite a bit. So instead, I start my conversation with focusing on stress. We can all understand stress, even though at times we sort of mean different things when we use this term. So with this foundation, let's start our conversation with this idea of what stress is, and then I'll be better able to show you how mind-body medicine tools can be used to help people manage stress and overall build their resilience. So what do I mean when I say stress? Stress researchers define stress as the non-specific response of the body to any demand. In other words, stress is considered to be our body's response to a demand. And these demands can be major life events, such as having cancer, or they can refer to daily small hassles like getting stuck in traffic or being late to work. They can also actually be good things like going on vacation. So by definition, stress is essentially normal, completely normal, and it's actually even appropriate to experience stress. But stress becomes problematic when it starts to outweigh our ability to cope. And so Lazarus and Folkman actually offered a model to describe this process of stress and coping and the imbalance between the two, or what happens when there's an imbalance. What their model suggests is that our experience of stress depends on the situation that we're encountering and our belief in our ability to manage this situation. So specifically, if you're looking at our kind of chart up here, what they're saying is that when there's a discrepancy between the demands, the experiences that we're having, and our perception of the resources that we have to cope with that situation, if the discrepancy between the two is small, then we feel stress, but the amount of stress we feel is small. And we often consider this to be positive stress or eustress. However, when the resources that we perceive ourselves of having are not meeting the demands that we're faced with, then that's when we feel high levels of stress, right? So again, the situation seems to be just too large to manage based on what we perceive being our ability to manage it. So when we have that experience of big stress or big burden, we experience distress. And that's actually our negative emotional reaction to this perceived imbalance. So what actually happens when we experience stress? Well, when we feel stress, our body is essentially mobilized to keep us safe. So that's actually what we're feeling. And in fact, there's actually a set of physiological changes that happen within us to keep us safe. And we call this the fight or flight response. And I'm sure you've heard this term thrown around multiple times. But what does it actually look like? It's our body's way of trying to protect us from danger. So think of it as it being something that happens that we do to keep ourselves safe from being attacked by a bear, for instance. So if you were being attacked, well, what do you need to happen? You need your big muscles to function, like your legs and your back, in order to keep you upright and moving. You don't, however, need to digest food while protecting yourself. And if anything, that's counterproductive and a misuse of resources. So essentially, in response to danger, your body is activating its alarm system. And we sometimes refer to that as a sympathetic nervous system. This allows your body to shut down or to redirect the resources to areas of the body that you need to respond to your danger, right? And so blood is moved away from non-essential places, like I mentioned, like your stomach, your hands and your feet, and it's redirected to the systems that you need to essentially defend yourself. And those are the big muscle groups I referred to. What this feels like, though, is cold fingers, a pounding heart, headache, dizziness, breathlessness, indigestion, you name it. You may notice that you start to sweat. Well, think about what your body's trying to do. It's trying to keep you safe. It's trying to help you. Sweating essentially is preventing you from overheating. However, all those things that you experience when you're in the stress response, it doesn't feel good. And if anything, it often mirrors or mimics a lot of the symptoms you may have experienced that alerted you to there being something wrong in your body, right? But if our body is trying to help us, why is the stress response a problem, you ask? Well, it's not if you're indeed being attacked by a lion, a tiger, or a bear. However, this response can become problematic when it gets triggered by daily life stressors or worries. So when you start thinking of things like driving or growing grocery shopping, or simply thinking about the multitude of things you have to do, all of these things trigger that same physiological stress response as that which would happen if you were being attacked by a bear. And in fact, our brain can't even truly find, it has difficulty being able to tell the difference between real and perceived danger, especially if we experience challenges and worry on a regular basis. So think about this. Let me just help you hit this further home. Negative thoughts, negative emotions, worry, sadness, all of these things can trigger that stress reaction, leading to the same uncomfortable reactions or bodily sensations that I just outlined earlier. And it's not uncommon for people to mistake these symptoms as indicators of disease, making them focus even more on that body part or that sensation that they're not feeling well. And in return, that leads to more worry, more paying attention to these symptoms, which makes these symptoms stronger. Why? Because they're essentially strengthening the stress response. And there are differences also when we think about how our brains work. If we perceive something as a threat, the way we're actually processing information is we have activation of the lower area of the brain, the amygdala, the emotional brain. And so what this means is that you're not thinking clearly. Your brain is not in position to do so when you're in the stress response. Why? Because it's intending to react quickly before thinking, right? Because if you're to take a step back and think and process a situation in a real dangerous situation, you can actually be harmed. But what does that look like? So I present this class to kind of exemplify what our brain or what our thoughts look like when we're in the stress response. So when we're in the emotional brain and not the rational brain, what it looks like is a glass of muddied water. All right. So essentially, if you think about a glass of water, if there's mud there or if there's dirt in that glass of water, when you're in the stress response, it's as if you're stirring that glass rapidly. And if you're doing it rapidly enough, you're not able to think clearly. Okay. However, if you're no longer in the stress response, the mud might be there. However, it's as if you're stilling that glass, you're putting it down on a table. Well, what will happen is the mud will drop to the bottom and you'll start seeing some clarity. All right. So that's the difference when your mind is in a distressed state versus when it's in a relaxed state. The idea then is that when you're repeatedly physically or emotionally stressed, your body is going through this cascade of physiological changes that essentially wears down your body and leaves you at risk for disease or for worsening of disease. Still, why do we care? Well, the reality is that stress, be it the significant stressors of cancer and cancer treatment or the small daily hassles of life, stress is our reality. And we don't have the ability to control or take away that stress, but what we have the ability to do is to control how we respond to that stress. And this is where mind-body tools come into play. Mind-body tools essentially balance, right? They create balance and they can be used to strengthen our resiliency. And the field of mind-body medicine is based on that recognition that our thoughts, our emotions, behaviors, our relationships, all of them can have a profound impact on our body and vice versa. And so mind-body medicine uses tools and techniques to help our mind influence our body. And these tools work by essentially deactivating that stress response that I described earlier to you, by upregulating the rest and relax part of our nervous system. In a sense, all the things that are going haywire when we're stressed are brought down to a baseline that's manageable. It allows you to maintain a sense of control and a sense of self-efficacy when you're managing daily life stressors, both big and small. So how exactly do mind-body practices work? Well, this is a very simplified diagram, but again, what they do is they sort of turn off that alarm system and they turn up the rest and relax part of our nervous system. So before I introduce a few different practices, I really want to hit home this message of how strongly our mind can affect our body and our physiological processes. So let's start with a lemon imagery exercise. And I invite you to go ahead and just get comfortable in your seats and start by breathing slowly for a few minutes. You're in the comfort, hopefully, of your home or in a quiet place where you can slowly tune out everything that's around you and just start focusing on the image that I'm going to create for your mind. So go ahead and when you're ready, close your eyes or lower and soften your gaze and continue to breathe deeply and slowly. And at this moment, go ahead and imagine that you're standing in your kitchen or the kitchen of someone you know. Choose a kitchen that you're very familiar with, one that is associated with pleasurable memories. And as you see various different kitchens you've known flash through your mind's eye, settle on just one. And imagine that you're standing at the doorway to this kitchen. Glancing around it, you notice the walls, the cabinets, the countertops, the floor. Imagine the appliances that are in this kitchen, the refrigerator, the stove, the oven, the dishwasher. Take a look at the countertops with your mind's eye. Notice the things that are placed there. And then over the kitchen sink, you may notice a window. And just imagine that the window is open and perhaps a soft, warm breeze is blowing in. Maybe it's gently moving any curtains that's around. And there are plenty of smells in this kitchen. Perhaps cooking or baking smells linger in the air. It is a warm and inviting place. Now bring your gaze back to the counter and notice that there's a beautiful wooden cutting board there. And on top of the board sits a bright yellow lemon. And you notice this lemon, you notice its color, a vibrant yellow. You notice its size and its shape. And as you're noticing the lemon, you reach out and you pick it up, noticing how it feels to your touch. The skin is both smooth and slightly bumpy. Maybe you notice the end where it was attached to the tree. And then next to the cutting board, you see a sharp kitchen knife. Go ahead and return the lemon back to the cutting board and carefully pick up the knife in your dominant hand. And then holding the lemon steady with your other hand, cut the lemon in half. And as you do this, you're feeling the knife slicing through the fruit, and you notice how it falls open, revealing beautiful jewel-like pulp in neat rows. And you see the fresh white pulp and perhaps some seeds inside. Some drops of juice have maybe even spilled onto your cutting board. Now go ahead and take 1/2 of the lemon and cut it again, making a quarter size slice. And then put the knife gently down and bring the lemon quarter up to your nose. And you start to become aware of the sharp, fresh citrus scent that's filling your nose. Slowly bring the lemon to your lips, noticing the sensations. And then open your mouth and bite into the lemon. All right. And with that, go ahead and open your eyes and reflect on what that experience was like for you. When I do this in groups live, I have individuals who tell me that they could smell the lemon and they could taste the lemon. And you may have noticed that your lips became pursed and maybe your mouth started to salivate. And I start with this prompt when talking about mind-body medicine and mind-body practices, because I want to emphasize this idea of how strongly your mind can bring about changes in your body. And so simply, again, with this exercise, envisioning a lemon can actually bring about the experiences that you would have if you, in fact, had a lemon readily available and decided to bite into it. And so what we believe underlies much of mind-body techniques and the effects of mind-body techniques is the relaxation response. As defined, the relaxation response is a hypometabolic physiological state that can be elicited by mind-body techniques like meditation, yoga, tai chi. To elicit the relaxation response, you need two things to happen at the same time. The first step involves repetition. You need to create an anchor, something that can hold your mind. And you do this by focusing on a tool, all right? This tool could be a repeated word, a repeated sound, like chanting, prayer, thought, a phrase, a muscular activity like rocking. But the idea is that you need a tool to repeat. And this tool, this repetition, serves to anchor your mind. The next thing you need to do is maintain a quiet, aware, and non-judging attitude, all right? So essentially, not worrying about whether you're doing it right or wrong, and just focusing on the repetition. Think of this process as being like a boat that's anchored to a dock. A current, right, if strong enough, may try to take your boat away, but the anchor holds it and it gently brings it back. So similarly, your worry thoughts or the thoughts that are trying to distract you, what they're going to do is try to be like the current and move you away. And what you're doing then through repetition is you're going to recognize that this is happening. So that's the awareness, and the non-judgmental awareness is essentially saying, I'm going to recognize it. I'm not going to judge it though. And I'm going to bring my attention back to the anchor that I've chosen for myself. So these steps break the train of everyday thinking and ultimately help quiet that alarm system that can go off in your body. And in doing that, that allows you to focus, understand things better, and choose a response that's more in line with how you want to respond, right? That's how you gain control. And remember how I said that clarity, the glass and the water and the mud. So by stilling your mind, again, what it's doing with this mind-body practice is bringing the glass and setting it down on a table so that the thoughts, they're there, they don't go away, but they're no longer distracting you and creating a sense of distress. There are many different techniques that you can use that fall under the mind-body practice. And I put some of these here because, again, I'm trying to move us away from this expectation of what's the popular or what's the one that we should be doing. Because again, I find that so many people have a preconceived notion about what mind-body strategies they should be doing. And when they try it and they don't like it, they decide that they don't want to do it at all. So I want to emphasize to you that there are so many different techniques, and the important part is just finding what's best for you. It's like going shoe shopping. The shoe doesn't always fit, so you got to keep trying it. You might be familiar with many of the ones that I listed here, such as meditation. The other ones that I try to emphasize are things like yoga, if you're into yoga, or the use of imagery, progressive muscle relaxation, mindfulness, and so on. I like diaphragmatic breathing a lot. It's sort of the basis, right? The easiest one and also the hardest one. And the reason I tend to pull this out when I'm meeting with patients is because you don't need any other tools, and it actually automatically deactivates that stress response without even trying any other techniques, right? The reason behind that is because when you're belly breathing, when you're breathing diaphragmatically, you're stretching the muscle fibers, okay, the diaphragm. And in doing that and stretching the diaphragmatic muscles, what that does is it signals your body to relax, okay? So automatically the stretching forces your body to start relaxing without you doing anything else. And that's critical because you cannot be physiologically activated and deactivated at the same time. It's incompatible. All right. So if you can learn how to belly breathe in the moment, you can learn how to calm your body in the moment, at least for that moment. Right. So the way to belly breathe is that by placing your hand on your upper chest and then placing the other one on your belly just below your rib cage. And then breathe in slowly through your nose, letting the air fill your lungs towards your lower belly. The hand on your chest should remain still. The hand on your belly should rise. If the hand on your chest is rising more, then you are chest breathing. And guess what that does? That elicits the stress response. So you will create that stress reaction. What I sometimes encourage people to do is when they're practicing belly breathing, that I would encourage them to lay down on a bed and just do that. Put your hand on your chest, put your hand on your belly and breathe, right? That forces you to sort of not hold your belly in, which we tend to do just generally. So go ahead, put your hand on your chest, put your hand on your breathe, and breathe in slowly, deeply. Slow it. Sometimes I say count to 4 or 5, depending on your lung capacity. It varies amongst people, but it's purposely said just so that you can slow your breath, pause for a count, and then slowly breathe out. And again, that act of breathing diaphragmatically is enough to deactivate your stress response. Another one that I love to use is guided imagery. Guided imagery is actually a really strong anchor for me. Anyone can listen to a story, and if you find one that works, then you're more likely to have that be your anchor. So if you find a meadow peaceful, search for a guided imagery exercise that walks you through a forest. If you like the water, look for a guided imagery exercise that places you on the beach or on a boat. Guided imagery is an active process. It involves the use of words and music to create a positive image. Very similar to the lemon exercise, although not everybody will necessarily indicate that that's a positive image. But same as with mindfulness, you're asked to purposefully engage all of your senses to recreate the image that is being narrated. And this process of creating that image and putting yourself in that image will help with quieting the body and the mind. Now, while guided imagery is popular, people can be encouraged to practice sustaining focus with their own visualizations. This can help create insight, awareness, self-growth. So for instance, sometimes I ask people to imagine success or a positive change. So remember that that connection between thoughts, emotions, and behaviors. Simply visualizing yourself engaging in a desired change will bring about movement or behaviors that will move you in that direction. Imagery can also rewrite negative experiences or memories. So perhaps you lost contact with a friend due to an argument. If you spend time imagining and recalling all the fun times you guys had together, that will create sensations of warmth. And it may inspire you to reach out, right? So again, creating an image in your mind's eye may prove to be difficult. So sometimes I encourage people to use a photo, right? Sometimes with my young adults, I suggest taking pictures. But when they're taking pictures, don't just snap them here and there. Take them mindfully, right? And so when you're engaging in the process of actually taking a picture, you are, again, engaging in a process that could be used to optimize the relaxation response, as long as you're engaging in it fully, noticing any thoughts that come, but not judging yourself for them, and then bringing your mind back to the image that you're trying to capture. Or if you're looking at a picture, right, and you're using that, maybe it's a trip that you had with family members that was so meaningful to you, take that picture and just relive that experience. And what you'll have is this cascade of events that happens physiologically and cognitively that help elicit the same emotions that you experience in that moment. And again, that process can help quiet the mind and quiet the worry thoughts. So mindfulness techniques, meditation, all of these things create a space for being able to enjoy life and be present in the moment. Autogenic training is another one that I often use with my patients. What autogenic training does is it focuses on bringing non-judgmental awareness to different parts of your body in sequence from beginning to end, some very much like you would do with progressive muscle relaxation. What this exercise does is it invites you to notice each part of your body and imagine that each part is warming and relaxing. This can help lessen any negative and threatening associations you may have with your body and instead replace those sensations with more pleasant ones. And as you move throughout each part of your body, you're invited to continue to breathe deeply and slowly in a relaxed state. If at any moment your mind wanders to worry thoughts, you simply notice that this is happening and you bring it back to your breath and to the part of the body that you're attending to, right? So that's essentially the key here, that aspect of repetition and non-judgmental awareness. And if you're doing it, if you're bringing it back to the exercise you're engaging it, then you are doing it right. And there are other things that you can do, right? So in this moment, maybe you say, you know, Giselle, I can't sit down for 10 minutes. It's just not in my thing to do. I don't enjoy doing it. Well, that's fine too. Use a simple breathing mini. Okay, so essentially, you might find that you're about to enter a medical encounter, or the phone's ringing and you're expecting to speak with a provider about something, right? In those moments, you're not able to immediately pull on a 10-minute, 5-minute mindfulness or guided imagery exercise. So in those moments, do a mini, right? So there's something, maybe not when the phone's ringing, but these are exercises that you do for about 30 seconds. Or a minute at most. It's a purposeful timeout, right? It pulls on the diaphragmatic breathing. Essentially, you're using something briefly to anchor your mind to automatically shut the response, that stress response. So a breathing mini might be counting very slowly up to 4 and then slowly back down to 1. So as you inhale, you say to yourself, 1, 2, 3, 4, not that fast, obviously, sort of like a second hand. You pause, and then as you exhale, you say 4, 3, 2, 1, much more slowly. Or you might envision a box, right? You can envision that there's a piece of paper and you have a crayon and you're slowly drawing a box, right? So this is not anything that's too complex. This is not anything that will take more than 30 seconds to a minute. But the point is that this is something that we know and have data to support that actually can be helpful to deactivate your stress response when you're in a moment of transition, when you need something quickly to help you in a moment so that you can focus. Think back to that cup of muddied water. If you're in the stress response, no matter how much you're telling yourself, focus, 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 you can't see through the muddied water. If you're in the relaxation response, then that muddied water is still there, but it falls to the bottom and you're able to think more clearly. All right. So I want to make sure I hit that home. There are many other techniques, and as we're nearing time, because I want to make sure we have time for questions, that I talk to my patients when it comes to mind-body practices, and actually they're the use of cognitive tools, right? So many of my patients say, because I run a program, the mind-body program, resiliency program here at MGH. Many of my patients say, okay, Giselle, this is great. The diaphragmatic breathing, it's awesome. It actually centers me in the moment. Or when I'm doing these guided imagery exercises, I feel it. I sense control. And then something happens and I'm back to being stressed. Yes. The reason behind that is because in that moment, you deactivate your stress response. But as soon as you go into a worry thought, it brings you back to being activated. So what can you do? Well, over time, continued practice of these strategies help that response be lesser and lesser so that instead of maybe coming up here when you're activated, you sort of come up to this point. But the other piece that's important, and often what you would work on with someone like myself, would be on understanding and tackling those worry thoughts, right? So sometimes what we do is we say, okay, now that you have a moment of clarity, let's observe what it is that you're telling yourself, the thoughts that are creating the stress response. That's creating that trigger for your alarm reaction in your body. And so we understand, we look to explore those thoughts non-judgmentally, and then we try to understand, okay, how helpful are these and how accurate are these thoughts? And then we use a variety of tools to help create balance in the way that we're thinking, not in a Pollyanna-esque way, because I think that also leads to a lot of sense of sort of internal turmoil and burden, but rather in a way that recalibrates and helps recenter the way that we're evaluating situations. And that's important because if you remember the slides that we started with, that aspect of life demands and our perception of being able to cope with the demands, that discrepancy or that interpretation that we're making alone is going to create that bigger stress response than the one that is more balanced. So with that, I encourage you to fully and non-judgmentally immerse yourself in the experiences that you want to enjoy, and those processes will enable you to be more centered in the midst of stress. So I would like to end there and open up for questions.
Thank you so much. We are now at the end of today's session, so if you have any questions for Dr. Perez, feel free to enter them in the chat. We have a question regarding the exercises you led today, which this person found very helpful. Do we need to practice them regularly for them to be effective in helping us build resilience, or can they be practiced as needed?
Great question. So the more, it's like exercise. The more you do it, the better, but something is better than nothing. So I wish I had a slide that I didn't show here today, but the idea is that the more that you're practicing them, you're recalibrating your stress response. So for instance, let me explain. Has there ever been an occasion, and I know you guys can't answer because I can't hear you, but think to yourself, where you maybe had a long day and you come home and somebody says hello and you jump down their throat. It's like all you need is one more thing and suddenly everything falls kind of to the side. Well, that's sort of the idea of when you're in a chronic stress state. You need very little. You need a pin to drop and you feel like you're about to burst. When you're engaging in these practices, what they do is that they bring you down so that it's not a pin. Maybe you need multiple pins, right? So the more that you do them over time, it builds that strength. However, doing them often or whenever you can is better than not doing them at all, because otherwise you're just going to remain in that chronic stress state.
Thank you. Of the techniques that you shared today, do you recommend any particular ones for specific situations where we're feeling stressed in the moment? Any quick and easy techniques that you recommend?
Absolutely. In the moment, especially when you don't have time, simply breathe. And it's amazing how effective that is. And I have so many, when I first meet with my patients one-on-one, we introduce, because we use multiple methods to tackle stress. But the first one is simply breathing. And they're like, no, that's not going to work. But when we go through the process of teaching how to breathe, they notice how in that moment you just start feeling relaxed. So I would actually go back to practicing how to breathe, which when you actually engage in this exercise, you're going to notice that it's harder than anticipated. So breathe and take that time out for, 20, 30 seconds, not very long. You'll notice that you'll be centered in the moment to then be prepared to engage in whatever you need to engage in. Aside from that moment, those minis are the ones that I actually advocate for. I actually encourage people to practice those more often than most other exercises. And I recommend using office dots, those yellow or colored office dots. They're circles. You can get them anywhere. And I recommend people put them all over places that tend to make them stressed, right? So sometimes I say, like, put them on your cell phone, put them on your home phone, put them on your maybe on your computer or on your office door, put them on your spouse's head. But anything that you need to do to remind you, practice a mini, then you'll start doing them more regularly and you'll notice yourself just being more centered throughout the day.
Thank you. You have provided great tips today, shared various techniques. Do you have any suggestions on where to go for more information on how to practice them?
Yes, absolutely. So a couple of different places. Obviously, I'm affiliated with the Benson Henry Institute for Mind Body Medicine. So they have on their website access to a bunch of other relaxation response videos, other meditation videos that are available to the public. As you know, if you are interested in our mind body groups, we have those that we run, and we do a host of techniques. The relaxation response is one component. There are other components that we integrate together. So I would encourage you to reach out to us for information about those groups. And then oftentimes I would say, if you want access to other techniques, the Honest Guys is an app that I have also seen some of my patients use. And they also have some more relatable mind body techniques, or sometimes I just say, Google on YouTube and find, a ocean guided imagery exercise or a meadow guided imagery exercise. And they have different time spans, and that allows you to find one that kind of fits with your kind of constraints.
Thank you. Regarding the program that you help out with, do you have to be a patient at Mass General in order to be part of it?
Yes. So actually it's pretty broad as long as you have a provider. So this could be a PCP, an oncologist, a specialist of any sort, then you are able to participate in the program. And it's but right now we have, and to be clear, the program is for individuals who have gone through cancer. We have some studies for caregivers as well, because we do recognize that this program is helpful not only for patients and their loved ones. And so we're trying to find ways to make this program more suitable to our loved ones as well.
Thank you. And are the sessions in person, virtual, hybrid?
Virtual right now. So we may move to a hybrid. Actually, I don't think it would be hybrid, in-person modality, but for now they're all virtual. They occur 3 times per year. So our recent group started in October. We have another group cohort that's starting in January. But yes, they're all virtual. They're in small groups, about, I'd say 4 to 8 patients at a time together. And we talk about everything, actually, life, because as I mentioned, life is stressful. So certainly experiences with cancer are discussed. But what we find is that what people really want to talk about is how it's impacted our life and our return to values or the things that we want to do. So we talk about these kind of challenges, and then we learn how to apply tools. So it's supportive in nature because everyone comes with a similar background. But aside from that, then it becomes very much skills-based. So it's using things like the relaxation response or cognitive strategies or other positive psychology tools to help manage stress.
Thank you. While we wait to see if there are any questions in the chat, do you have any final thoughts you'd like to share with the audience?
No, I think, I am excited that you're here and you have this interest, and certainly don't hesitate to reach out. Mind body practices or relaxation response strategies, they're, this big unknown, but they're not as challenging to do if you find the right tool. So I encourage you to explore.
Thank you so much, Dr. Perez. This was very helpful. And everyone, thank you so much for joining us today. As I had mentioned, today's session is being recorded. So if you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.
Thank you. Bye-bye.